Hi, everybody. Welcome back. I wanted to talk about my experience with my vasectomy that I had back in December, and maybe to share the experience with you. And maybe if you're contemplating getting a vasectomy or you got one scheduled coming up pretty soon, maybe it ease a little bit of your anxiety about it. So, I was contemplating. My wife were pretty sure that because I have an 11-year-old daughter, she's almost 12, and my wife and I. Going back even 5 to 6 years ago, we were pretty sure that we were going to have one, that we were settled with just one kid. And it contemplated getting a vasectomy. I should have had done many, many years ago, but I was scared and nervous and didn't really want to go through with it. I was kind of putting it off. I figured there were other options out there. So, eventually we hit our deductible um, this past year, and so I got it done for free, which was a pretty good deal. And my wife's like, "Oh, we already hit our deductible," and she's like, "We're really sure that we want to have any more kids. So would you be willing to get a vasectomy?" And I was like, "Oh, sure." But in my mind, I'm like, "Oh God, what am I getting myself into? Oh shit!" But I want to get that's to me that's the best method of birth control, well, besides abstinence. That having a vasectomy, I think, is the best. I mean, it's less invasive. It's for a woman to have her tubes tied. That's a method that's pretty as far as pregnancy goes. It's preventable. Um, as far as pregnancy goes, but it's more invasive. It's easier for a guy to have a vasectomy. It's not as invasive. So, what happened is I think before I saw a urologist, and he examined me. It kind of told me about the procedure, and this may be a little too much information. I apologize if it is, but on my left testicle, I've had ever since I was a child, I have a varicocele. So my left testicle is enlarged. It's a lot bigger than my right. So, the vasectomy is basically cutting off to prevent sperm from entering the urethra. They cut the vas deferens, and that tube, the vas deferens and left testicle. He said it was going to be a lot harder. He examined me, said it was going to be a lot harder to access. So right away, he's like, "Oh, this is pretty big." He's like, "You're going to have this done in the hospital, otherwise it's going to be really uncomfortable." And he told me about how they give you like a numbing lidocaine. They give you like a shot in the balls, and from what I understand, that feels like a flu shot. That's like the worst part of it. And then supposedly that area goes numb pretty fast, and they start working on you pretty much right away. And he said, "Yeah, if you're a little bit nervous, if you have some anxiety about it, I could give you some gas." And he said that helps too. It's like, some people get that when they go to the dentist to ease their anxiety, to ease the pain. But I wasn't really sure about it. Like he said, I was going to have it done in the hospital, but I forgot to ask him. And obviously, you can't get a hold of it. It's like impossible to get a hold of a doctor. And he called the office. But I kept thinking, like, are they going to put me out? Are they going to put me out? I wasn't really sure about it, but I assumed since I was in the hospital, that's what they were going to do. So, I think I had scheduled a couple months. I got the examination, and then I had the vasectomy scheduled 2 months out. So before I did it, I had to get a COVID test, and didn't even go into the clinic. There was a sign saying to park. It had like a diagram that showed you like where to park for pre-surgery for COVID testing. And it was basically like a self-test. And I think I just didn't have the willpower to stick the Q-tip up my nose enough, because the test came back. Because I asked the woman, the nurse, whatever, I said, "How far am I supposed to stick it?" She said to swab it 10 times in each nostril, which I did. But I must not have gone up far enough. I just didn't have the willpower to do it. She said, "Yeah, just go up as far as you can comfortably stand." But it turned out to be inconclusive. So the day of the surgery, I go to check in, and I had to get another COVID test. It was a rapid one, which you get back within like an hour. So they had to put me in isolation while I was getting the results, and it came back negative. I was pretty nervous. My palms were sweating. I know the nurse was hooking up the IV to me. My hands are pretty sweaty. She's like, "Oh wow," because she was having trouble getting it to stick. She said, "Wow, your hands are sweaty. Are you nervous?" I'm like, "Oh yeah, I definitely am." And so I got the IV, and then I got the gown on, and it was like, wow, like this is really happening. I was really nervous about it. At one point, I was almost about ready to cry a little bit. I'm like, "Oh no, no, stop, stop, Jeff, be a man. And then when I think an anesthesiologist, the doctor came to see me, and he said, "Okay, we'll get you fixed up here real quick," the urologist. And then the anesthesiologist came over to see me. So that's when it was like confirmed that I was going to be put out for this. And I don't even remember. Usually they tell you, because I have had I had my wisdom teeth taken out when I was about 20 years old, dental surgery, and I was put out for that. And I do remember them telling me to count backwards from 10. And same thing when I got my throat scoped about 13 years ago, back in 2009. Got my throat scoped because I have GERD. They wanted to see what was going on down there. Everything was normal, but that wasn't a surgery, but I was put out for that. And I do remember waking up a little bit and seeing the doctor with a tube down my throat, feeling like a little bit of pressure, not pain. That was my biggest fear. I was kind of worried I was going to wake up during the procedure, but they put me out pretty good. I don't even remember counting back from 10. I just remember them putting the mask on, and next thing you know, I'm waking up. But it was pretty scary getting pushed in to the operating room and just seeing the bright light and all the people around, these female techs, nurses, whatever they were, and then seeing all the instruments. I'm like, holy shit, this is what's going to get used on me, and all these women are going to see my junk. I'm like, oh my God. And I think, yeah, getting put out definitely hid some of the embarrassment, even though they don't really think much of it. It's just their job. This is what they do all day long. But typically you're awake for a vasectomy. They just numb you up and they start working on you, and then there's a nurse present. But I would think that would be really awkward, even if there was no pain, to have like you're awake and you have like a doctor and a nurse like working on you for like 20 or 30 minutes with your junk exposed like that, and they're right there. But even though it's their job and they're used to it, that's what they do all day long. It's just embarrassing for the patient. But I was put out, and next thing you know, I woke up. I guess even though I was put out, the doctor is still, because that was the part I was dreading the most, which I was put out for it. But I guess the doctor still gave me a bunch of shots, a bunch of lidocaine, a bunch of shots in the balls. I'm like, oh, wow, you still had to do that? And normally they only have to make one incision to access each vas deferens. But I guess because my left one, the left testicle is enlarged, I guess the first incision he made was unsuccessful in accessing the vas deferens. So he had to make an incision on the side. Had to make an extra incision, and then he was able to access that vas deferens. But yeah, next thing you know, I woke up and I was pretty oozy. I felt I was like really happy that it was all over with, and the painkillers, the anesthesia hadn't quite worn off yet. The lidocaine hadn't worn off, so I actually felt pretty good. I was walking around just fine. But then later on that day and the next day, I think is why I was in the most pain, and it wasn't that excruciating. It was more or less just discomfort, and they said, in which I did, I followed doctor's orders. They get some frozen peas ready and put them on your balls, 20 minutes on, 20 minutes off, which is what I was doing a lot of sitting around. And I was still hurting a little bit. I should have taken more time off from work, but I thought I'd be better. But I had it done on a Friday, so I took that Friday off, and I figured I had the weekend, and then I took an extra 2 days off. I took a Monday and a Tuesday off, and I went back to work, and I was still hurting a little bit walking around, and especially bending over. They did put stitches in me where they made the incisions in the scrotum, but they use dissolvable stitches because I did get a call saying that I needed a schedule to get the stitches removed, and the doctor just turned it into a follow-up. I went to see him, and I said I was ready to. He's like, "Oh, what are you here for?" I said, "Oh, I'm ready to get the stitches out." And he said, "Oh, those are the dissolvable stitches. You don't have to get them out." And he said, "If I did take them out, you'd be completely opened up right now. I'm pretty sure you don't want that." And this was like 2 or 3 weeks later. I'm like, "Okay." So eventually they just dissolved, but that was the most uncomfortable part because yeah, it was just, especially sleeping on my side. It's like the stitches on the sides of my scrotum were like rubbing up against my thighs, and they're kind of like pulling. So that was the most uncomfortable part of it. But yeah, I recovered. I think a total recovery took me maybe about 8 or 9, 10 days or so. I do remember a week later playing basketball, shooting some baskets. So obviously I healed a lot quicker than I expected. I think healed a lot quicker than most people do. So yeah, I think that's all I got to say about that. It really wasn't, I mean, it was different than most guys' vasectomies because I was put out and I wasn't awake. But from what I understand, most guys, when they have the vasectomy, that shot hurts. They give you in the balls, but then you just feel like when they're working on you, you might just feel like some tugging and pulling. Maybe you should just feel pressure. You shouldn't feel any like severe pain or discomfort. I was just put out because mine was going to be really uncomfortable if I were awake. But I think most guys that don't have that varicocele, you're awake and you just feel like some tugging, some pulling. So that's what I've heard about that. I did know one guy that had it done, and he said, yeah, that's how it was. It wasn't that bad at all, just minor discomfort, not severe pain. Um, One of my friends from high school, I was telling him I had a vasectomy, and I was like talking about sitting around for the weekend watching a bunch of sports. And it's funny, my one cousin, I know he had a vasectomy done. I don't know when he had it done, if he had it done during March Madness, but he said, oh, I'm going to get my vasectomy done during March Madness. I could just sit around and watch a bunch of hoops. And then his wife, I don't know if it happened, but his wife is like, oh, no way, you're not doing that. You're not getting off that easy, you know. And then one of my friends from high school said he knew a guy that had a vasectomy a few years ago, and I guess he had purposely had his done during March Madness. I guess he picked out his favorite recliner, and he just sat around with frozen peas on his balls and watched a bunch of hoops. And I guess his wife just bought him beers, and his friend from high school was like, oh, wow, that's the wife. And I'm like, yeah, that's fucking hilarious. So that's my story about that. I hope it eases your anxiety. If you're thinking about having one done, I definitely highly recommend it. It's a very good form of birth control. I still have to wait. I still have to get a semen analysis to make sure that there's no sperm in my semen. I still have to wait a couple more months. They won't see me. I figured I could get it done sooner. I'm not sure right now if I'm sterile or not, so I'll find out in June. I thought I could get it taken care of sooner because they mentioned like the number of ejaculations that have to take place. So before all the sperm are flushed out because they're still swimmers. So I have to go in June, and they won't see me until June. I have to go to a clinic and get a semen analysis, and then I'll find out for sure if I'm sterile or not. And then it's like, it's like 99 point. Like I said, it's a really highly effective method of birth control. Vasectomy, it's like 99.99% effective, and there's like a 1,000,000,001 chance that you could still father a child. So I'm not going to be that 1,000,000,001. So yeah, I hope that eases your anxiety. If you're thinking about getting one, I highly recommend it. And good luck to you. And you've had one. Share your story with me. And I think that's all I have to say about that. Comment, like, share, subscribe, and I'll see you all real soon with another great video. Have a great day, everybody. Talk to y'all soon. Bye.